So, gentlemen, I'll have each of you briefly introduce yourselves. Just give us 1 or 2 sentences explaining who you are in the world of Ibogaine. And then after we do a round of introductions, I'll have some questions and we'll go a little bit deeper into each of your work. So, Dr. Dos Santos, will you introduce yourself first?
Hi, thank you. It's a pleasure for being here. I am a Ph.D. in pharmacology. My studies are mostly focused on randomized trials with ayahuasca in healthy volunteers and clinical populations. And we also work with cannabidiol here in the University of São Paulo. And I am just a novice in the Ibogaine world. We have the chance to conduct this controlled trial in Brazil. We are very happy with that. But I am very, very new in this field, so I think it would be that.
Well, we're glad you're here. And Dr. Paškulin, can you tell us about yourself?
I have a PhD in biotechnology. Was always interested in psychedelic drugs and mind-changing experiences and methods. So I defended a thesis on influence of entheogenic drugs on gene expression, especially, focused on Ibogaine. So this will be my try to briefly, in a couple of sentences, explain what is my hypothesis, how Ibogaine works and why it works in such a prolonged and life-changing way. Differently from drugs that you have to use at every day to make an effect. So what is that?
Yeah, and we will definitely circle back around to that. I'm sure everyone wants to hear more about that. That sounds fascinating. And Dr. Sola, would you say hello in a sentence or 2 about who you are in the Ibogaine world?
Good morning.
And if you have a slow connection, Dr. Sola, it looks like you do. You may want to turn off your video and just do the audio and we can just listen. Okay, we'll give him a moment. And Dr. Kudoli, how about you jump in?
Hello, I meet you. And hello, Roman.
Hi, hello.
Yeah, here.
Yeah.
It's a great friend.
Yeah.
Okay, I am Dr. Sergey, and I am from Kyiv, from Ukraine. I am medical doctor and medical director in the Medical Center of Medicament. We are opened that center 2 years ago and start our individual practice. I have the experience in the anesthesiology, narcology, neurology, and now I am finished my PhD about some trauma brain injuries and some neurotransmitter system, and during the 2 years we have some great practice, not only like the Ibogaine practice, we have some addiction treatment clinic where is the use and provide Ibogaine, and for the general medicine, for the detoxificated from the opiates, alcohol, and the other practice. I think now I have some good idea when I finish my PhD here. I have some cooperated from the medical university in 2 medical university in Kyiv and some 1 big pharmacological company, and I think we want to start learn Ibogaine some fundamental practice like a pathophysiological practice. I think that must be a little bit later, but today I think we speak about Ibogaine in the medical practice, Ibogaine in the mental practice, and for the general about Ibogaine. Thank you so much.
Thanks for joining us. I'm so glad you're here. It sounds like you have a wealth of knowledge. And Dr. Sola, are you here on audio? Can you hear us? Dr. Sola, are you there?
Yes, I'm here.
Yeah, Dr. Sola, unfortunately you are cutting out. So I will introduce you. So Dr. Alberto Sola is the president of Clear Sky Addiction Center in Cancun, Mexico. My understanding is he has a great interest in Ibogaine safety and the adverse effects of Ibogaine specifically related to fentanyl use. And he actually works with Ibogaine with individuals in Mexico, and he has treated more patients with Ibogaine than perhaps any other provider in the world. So he has a wealth of knowledge. Dr. Sola, if we continue to have issues with the audio, I invite you to write in the chat. I'll keep my eye out. And if I see that there's something from you in the chat, I will read it and share it with the group. And hopefully we'll be able to hear some more from you. So diving in a little deeper to everyone's individual work, let's start with you, Dr. Dos Santos. You are currently working on the first randomized trials with Ibogaine for alcoholism and Ibogaine trials for addiction to methadone. Can you tell us a little bit about those studies and what we're learning from them so far?
Sure, it's a pleasure. The first trial, the one that we are conducting here in Brazil, we are in Ribeirão Preto. It's a city inside the state of São Paulo. We are of the Ribeirão Preto Medical School in the University of São Paulo, one of the biggest in Latin America. And in 2017, we received the ethical committee approval to the study, but we had a problem, a delay due to bureaucratic issues with Brazil and India. Are just waiting for the authorization of the university to start authorization to conduct trials. At the moment, the trial stopped. This study is a collaboration, a partnership with ICER's Foundation from Spain, Barcelona, of Ibogaine, which are usually the paradigm that most people work with until the present moment, to my knowledge. And we started to think about slowly increasing doses. So based on that single case, a methadone patient that was trying to quit methadone, we designed a study here with alcohol patients, which alcohol is a huge public health problem in Brazil and all South America. We really do not have a heroin or opiate problems here. And this first trial will be very small with only 12 patients. We will be increasing the dose in the first 3 patients, and the 3 higher doses will be randomized in these other 9 patients inside our hospital with all the clinical care that's necessary. And at the same time, Dr. José Carlos Bolso's team in Reus, in Barcelona, near Barcelona, in Catalonia, Spain, developed another protocol for people that were previously mostly addicted or their dependence on heroin, changed it to methadone, and they were having problems leaving methadone. So the same idea will be proposed there, but there are 2 arms with 10 volunteers in each, with 6 sessions with 100 milligrams Ibogaine 6 times or increasing until 600 milligrams. And their study already started in November. In fact, they already treated the first 2 volunteers. I cannot speak officially for this methadone study because the coordinator is José Carlos Bolso, but it's also a partnership with University of São Paulo. So these, to the best of our knowledge, were the first 2 randomized trials, the only ones that until today are in clinical trials. And we are starting these to try to increase the scientific gaps that still surround Ibogaine. We have several observational studies around the world, but not a single controlled trial to see doses in a more formal scientific way. So basically that's what you're doing. We do not have data to share because the study in Spain is in only volunteer number 2 from 20, and it's blind and randomized which group each volunteer is. And our study in Brazil, we are still just waiting for the university authorization to start the trial due to the pandemic.
Yeah, so hopefully maybe next time we have a conference like this, you'll come back and be able to report the findings of these trials. And yeah, I do hear you that the pandemic slowed down research. Is there a control group in these trials, and what's the placebo intervention?
In the methadone study, there are just two arms: the 100 milligrams doses and the increases 100 to 106 milligram dose. So there's no placebo on this trial. And in the Ibogaine trial here, the first three volunteers will receive from 20 milligrams to 400 milligrams open. Each one will receive 3 different doses, one bigger than the other, and receives the last 3 doses, which would be around 240 milligrams and 40 milligrams. And if these 3 higher doses are well tolerated and safe, the other 9 volunteers will be randomized to receive a placebo and 2 of these doses, and a placebo and another, or 2 times placebo, no, 1 time placebo, the other 2 doses, and the other 3 doses in 3 fixed order randomization.
What do you think the placebo will be? Do you know yet?
Yeah, placebo will be an active substance, but they will be treated in the same setting. As in the same intervention that the patients will receive will be all the same. They will be in the hospital. We are not measuring abstinence here in the sense of alcohol withdrawal syndrome. So after the withdrawal passes, they will enter the trial. And all of that, they will be treated the same way in the psychiatric unit of our university hospital.
Okay. Okay. Sounds fascinating. I'm excited to hear about it, and hopefully we'll have you back at another conference so you can actually present some of the data. Dr. Paškulin, question for you. So you recently defended your thesis on Ibogaine's influence on gene expression. Does Ibogaine really affect our genes? And if so, how? What do we know about this at this point?
Everything affects our genes, you know, it's a very dynamic process. All the cells in the body have the same genome, but they're morphologically different and they are functionally different, and they build an organism which at the end acts as a subject, as a psychological personality. So my hypothesis was, my basic question was, how is possible that single dose of some drug can alter somebody on a certain way, which I wanted to discover, that it would last longer, as they say, life-changing experience.